Psychosis in young people: prevention, intervention, self-care, support, and recovery. Psychosis refers to a range of symptoms in which there is misinterpretation and misapprehension of the nature of reality. The individual's beliefs, feelings, thoughts, senses, as well as behaviors are altered, and the ability to recognize what is real and what is not ultimately becomes challenging. Early psychosis relates to the early course of a psychotic disorder in which scientific research has not been able to adequately explain how psychosis develops. Globally, 3 in 100 people experience a psychotic episode in some point of their lives. However, not everyone experiencing psychotic symptoms necessarily has the presence of the disorder. Research studies have identified factors that protect against a young person developing a mental illness. Through the following aspects, they can all contribute in facilitating the young individual with their needs and requirements. Living with psychosis. Social factors such as support networks and relationships, effective therapeutic communication, as well as developing good social skills can facilitate the young person's needs in creating a stable network. Educational needs such as creating opportunities for participation in a range of school activities and providing extra assistance can also be helpful. Psychological determinants such as allowing the individual to recognize their own self-worth and independence, creating positive affirmations and self-hope for the future can benefit their ability to self-regulate their behaviors and emotions. Environmental determinants such as providing a warm and safe environment at home, childcare and/or school can make the young individual dealing with psychosis feel safe and included. Furthermore, their overall health as well as the healthcare system should be aimed in assisting with dealing with their psychosis. This should include seeking appropriate care and treatment, assisting with treatment, as well as providing appropriate medications that ensures their mental health are optimal in actively engaging and dealing with their psychosis. An overview of how they experience their illness. Symptoms experienced by a person with psychosis are different for each individual. Some may experience just one symptom, and some may experience more. They may also experience a symptom as a one-off experience. It can be sudden but not persistent, or they may have symptoms that persist. Symptoms include confused thinking, which is when the person's thoughts aren't clear or coherent. The individual may also find it difficult to remember things and may find it hard to follow conversation, as well as having difficulty with concentration. Their thoughts may even seem slow or fast at times. An individual experiencing psychosis may also have false beliefs. These are also known as delusions. A false belief is a strong belief in something that is not true, and isn't a belief the person usually holds. An example of a delusion may be that a person believing that their parents want to hurt them, or the cars outside their houses are people watching and following them, when in reality, this is not true. Hallucinations are also a common symptom of psychosis. A hallucination is when the individual can see, taste, feel, or hear something that is not actually there. Changed feelings are another symptom of early psychosis. These are when the individual's emotions can change for no obvious reason. It is common for the individual to have changes in their mood. They may go from feeling very happy and excited to sad and depressed. The individual with early psychosis may also experience a change in behavior, where their behavior is altered from their usual self. They may have higher energy levels or lower energy levels compared to normal. They may also behave or react inappropriately in certain situations, such as laughing when things aren't funny or becoming upset for no apparent reason. The most common treatments for psychosis include cognitive behavioral therapy, or CBT, omega-3 fatty acids, psychoeducation about early psychosis, and support from family. CBT is preferred as treatment for early psychosis. It may decrease occurrence of symptoms of psychosis and also reduce occurrence and delay or prevent the individual from progressing to the pre-onset phase of psychosis. It is also mentioned that it can help in the pre-onset phase with social functioning. CBT is the primary psychological treatment for early psychosis. It challenges the individual's thought patterns and behaviors associated with their thoughts. Omega-3 fatty acids have also been found to help in the pre-onset phase of psychosis and have shown to improve social functioning. Psychoeducation is important and should be accessible to individuals with early psychosis, as well as their families. It is vital in the treatment for this early psychosis. It helps the individual and their families develop a more profound understanding of the illness, such as what the illness is, the treatment options, and recovery. It also helps as it makes the individual and their families feel engaged, and also reduces the fear they may have of being helpless by learning more about early psychosis. It also can reduce stigma and help to improve compliance with CBT and medications. When dealing with psychosis in young people, anyone presenting with possible psychosis will have a comprehensive biophysical assessment. This assessment includes developing an understanding of personal context towards illness and developing a case formulation around it. This can assess their mental state and any signs or symptoms. A physical examination and investigation of baseline assessment, lifestyle factors like diet and exercise, and a talk through of appropriate treatments. A cognitive assessment and a comorbidities risk assessment is done to check if there may be any contraindication that may affect their care. These should be done at every routine visit. A routine assessment of symptoms, mental state, suicidal intent, insight, and the role of psychotic episodes on their mood should be conducted at every visit. Engagement should be prioritized as the main foundation for early psychosis treatment. Different variables can affect how an individual will engage with care. The therapeutic alliance can establish a level of trust and can help gain information to help enable diagnosis and the formulation of care for the patient. Accessibility to care can impact how a patient engages. If there is a distance in how far they must travel or wait, this can affect how well they communicate and trust the health service and the staff. Enabling the patient to feel as though the plan being made for them is addressing these concerns and goals will allow for more engagement and build on a therapeutic relationship. Family involvement can be a major factor in which the patient will engage in treatment or not. So it is important to try and build a therapeutic relationship not only with the patient but with their families as well. There can be negative factors which can affect engagement. A lack of trust with care can be caused from poor engagement and poor quality of care. This can lead to worsening of clinical outcomes and can be a cause of symptom relapses and rehospitalization. There are many strategies to increase engagement and the development of a therapeutic relationship. This can be from the prioritizing autonomy, empowerment, and respect for the patient, which helps focus the nurse to make it patient-centered. Nurses will use a framework in which helps prioritize the patient's needs to enhance treatment. Using shared decision-making between the patient and their family will enable nurses to tailor the goals and circumstances of the patient. As a nurse, we can observe behavior, appearance, mood, and understanding of our patients, and as such, we can reorient the care we provide. With building on a therapeutic relationship, we can help improve engagement levels by asking specific, open-ended, and probing questions that allow our patients to speak openly and think about their answers. We must be supportive and hold our conversation to the therapeutic needs and must be able to adapt if need be to keep our patients and their family engaged with this care. In saying this, there must be a level of experience and training to support the patient and families. Overall, we have to validate our patients and have a full understanding between one another to make them feel as though what they are going through and saying is important and striving towards their goals. Early intervention plays a significant role in the prevention and recovery of young people, as the majority of young people who meet the criteria for a mental disorder either delay or fail to seek professional help for these problems. Origin works directly with young people, their families, and friends to advocate to make change with positive approaches to prevention and treatment. The Early Psychosis Prevention and Intervention Centre, or EPPIC, is a government-funded service which aims to facilitate the early identification and treatment of psychosis. It strives to reduce the disruption to the young person's functioning and psychosocial development. Evidence-based research tells us that it is necessary to decrease the duration of untreated psychosis for the individual in order to facilitate the ability of the young person's life to continue, while satisfying their social, mental, and emotional well-being. The EPPIC program is able to provide support to the young person through evidence-based treatment programs and research, as well as face-to-face mental health assessments. To refer the individual to the appropriate care as previously mentioned, not all psychotic symptoms indicate the presence of a disorder. The EPPIC is moving away from the stigmatized model of no hope to one of recovery. This program has provided users with simple structure to develop upon their abilities to enable them to function. The Australian Clinical Guidelines for Early Psychosis, developed by Origin, suggests that early intervention is important as it enables timely reduction of distressing experiences. It reduces the duration of untreated psychosis, provides better outcomes in short-term care, is cost-effective, and thought that early intervention may prevent an onset of a psychotic disorder. To recap, psychosis is a misunderstood and misdiagnosed mental illness that affects a large percentage of the world's population. Symptoms of this mental illness differ for each individual, and each experience of psychosis is distinctive. Some symptoms include blurred thinking, false beliefs or delusions, as well as hallucinations. A common treatment for psychosis is CBT, as well as psychoeducation. It is important for nurses to engage with their consumers in a therapeutic way to build trust and develop goals with the individual to best suit their needs. Early intervention is a crucial part of intervention and recovery. There are government services such as EPPIC that aid in early identification and treatment of psychosis. Their aim is to minimize the changes in the young person's daily life. This program offers support to the young person as well as their family. If you or someone you know needs help, help is available.